Labor is often said to be the most painful thing a woman will experience. For someone who has never delivered a baby or seen a baby delivered, it may seem impossible. Pushing a cantaloupe-sized baby head out a cervix only dilated to the size of an orange is less than probable. For such a painful experience, the majority of women receive an epidural, around 60 to 80%. I hope to give you the information regarding epidurals to assist you in making this very important decision. There are 4 topics we will be covering today. The first topic is what an epidural is. Most times, a woman knows an epidural numbs the legs and relieves pain, but I will address how the procedure is done and a little bit of the science behind how it all works. The second topic we will cover is who administers an epidural. The majority of women can agree that an anesthesiologist will administer her epidural, but often look past how knowledgeable and educated an anesthesiologist must be. It is very important for a woman to be able to trust her anesthesiologist. Next, we will cover the benefits of receiving an epidural. Pain relief is the most obvious benefit, but there are many more. We will hear from mothers who have had good experiences with epidurals and learn from their experiences. Then we will talk about the risks. An epidural is not a minor medical procedure. There are many things to consider that could go wrong. Here again we will hear from others, but this time we will hear from the women who had bad experiences with their epidurals. This first picture is showing the insertion of the needle into a woman's back to deliver anesthetic. To start, I will introduce myself. I am a certified nursing assistant. I took an intense 6-week course over the summer of 2013 to obtain certification. After completing 120 course hours, including 40 clinical hours, and passing a state test, I was officially a certified nursing assistant. I became employed through Mayo Clinic Health System in August of 2013 and worked with the Family Birthing Center. I now have 1-year experience working with pregnant women, OBGYNs, family doctors, and a wide variety of nurses. I have assisted in the deliveries of over 15 babies, and I also have experience dealing with women who received epidurals and women who had non-medicated deliveries. I will begin with describing what an epidural is and how it works. An epidural is an anesthetic injected into the epidural space of a woman's back. As you can see in the picture, the dura is the space around the spinal cord. The formal definition is the tough outermost membrane surrounding the brain and spinal cord. The syringe with the spinal anesthetic is what is done first. This will numb the area so you cannot feel the epidural catheter being placed. The next step ranges per provider. Some anesthesiologists will then insert the small tube, or also called a catheter, through the same needle that inserted the anesthetic, and some will take out the first syringe and insert the catheter through a different needle. This picture shows the catheter going in through a different needle. During an epidural, both sensory nerves and motor nerves are blocked. A sensory nerve relays pain information from the skin and muscles to the spinal cord and the brain. The pain sensation is caused from the sensory nerves being stimulated. A motor nerve controls the movements and actions by passing information to the brain and spinal cord. The motor nerves control the body's movements, and when the motor nerves are blocked, the part of the body where the nerves are blocked is paralyzed. Together, both nerves being blocked, the pain sensation and movement is minimal with an epidural. The top picture is a diagram of a sensory neuron, and the bottom picture is a diagram of a motor neuron. This picture is very informative. The red-orange color on the patient's skin is iodine. Iodine is a cleansing agent used often during procedures to prevent infection. The anesthesiologist will use 2 swabs, rubbing the area for 30 seconds each. The second part of this picture is the catheter. The small tube coming out of the patient's back is the catheter which administers the anesthetic. The one thing missing from this picture is the bandage that will be placed over the catheter to hold it in place. This picture is similar to the one above, only it shows the initial injection, which will insert the catheter. The next subject is who administers an epidural. An anesthesiologist is a doctor who specializes in anesthesiology. After completing 8 years of schooling to obtain a doctorate degree, the student must pass the USMLE state test in order to begin their residency. It is very important to know just how highly educated an anesthesiologist is so that you can earn their trust. Now we will talk about the benefits of receiving an epidural during labor. There are many different theories on epidurals, and I will be giving you the information I believe to be most true. The first and most obvious is pain relief. One thing that women do not know is that the pain is not completely subsided. Oftentimes, women do not feel the contractions, but as the baby gets closer to being delivered, women will be able to feel pressure. With the contractions subsided, a woman is able to rest while she is dilating. This can be a very appealing benefit to a laboring woman who needs all the sleep she can get before she starts the next chapter of her life. I have done lots of research on this topic, and my conclusion is that the health of the baby is not jeopardized. The only negative connection I found is that the baby's APGAR score could be lower than a baby whose mother did not receive an epidural. An APGAR score is a measure of how good a baby is breathing, how their heartbeat sounds, and other factors such as whether they are looking red or pale. If a baby has a lower APGAR score, the long-term health is not jeopardized. And finally, epidurals do not increase the chance of C-section. This is because when a woman has to go to C-section, they often try for a very long time to deliver vaginally. The pain of being in labor for such a long time is hard to endure, and it is very easy for a woman to break down and get some pain relief. Now this is a story from a woman delivering her first baby in 2008. I had an epidural with my baby 2 months ago. I have had absolutely no problems, not even sore at the injection site. I was able to visit and laugh with my family during labor and delivery. I could feel my stomach tighten when I was having a contraction, and I felt when she came out too, but I felt no pain. It was very easy. And this next woman has a great perspective with having a delivery with an epidural and a delivery without an epidural. She also delivered in 2008. I tried both. My natural birth went fine, but I don't remember much except the pain and having to concentrate on coping with the pain. With the epidural, I was able to enjoy the experience of the birth, and I remember every last detail of the delivery as well as watch. It was an amazing experience being able to see it all happen pain-free. We will now talk about the risks of receiving an epidural. One of the first risks is the chance of spinal headache. A spinal headache occurs when the cerebrospinal fluid, which is inside the dura, leaks out during the procedure. The more attempts it takes for an anesthesiologist to successfully place the epidural, the greater the chances there are for spinal headache. It is estimated that around 4.6% of women receiving epidurals will get a spinal headache within 48 hours of delivering. There is a risk of the epidural not working due to incorrect placement of the catheter. This most frequently occurs when the patient is not able to get into the optimal arch-back position, and it occurs in around 7% of women. Another risk is the chance of severe back pain. Being the most common side effect, back pain occurs in nearly 18% of patients. Lastly, the final risk is an epidural can sometimes take multiple attempts to successfully place. Placing an epidural can be a trial and error process, and doctors have difficulties with certain women. This woman did not have a good experience with her epidural. She says, "I have 2 children. The first labor I got an epidural, and I have regretted it since then. The anesthesiologist had to try to administer the epidural 3 times because he kept hitting a nerve in my back that sent pains down my leg. I still have issues with my back and can't be nearly as active as I used to be before the birth because of nerve damage in my back." Again, a woman with a bad epidural experience says, "I had an epidural and had a few side effects. First, I believe the anesthesiologist poked my spine about 6 times before getting the needle in right. Secondly, I had spinal headaches. They said it would go away within 15 hours, but it never did. I cried constantly. 2 weeks went by and the headaches never subsided." To put everything in perspective, a baby will be the result of labor with or without an epidural. Each person and each person's life experiences are unique. The most important thing is to make a decision that makes sense for you and your baby.